The article focuses on crowdsourcing as a method for developing a large database that can be accessed by an artificial intelligence at a low cost. By using the work of a collective, there are uncertainties regarding the accuracy and reliability of using crowdsourced data. Despite this, using humans to create labels for data is an important and cost efficient technique. Because of how fast and cheap crowdsourcing data is, companies have begun to rely on crowdsourcing for data. Using this diverse data, learning systems are capable of evolving. With more complex and diverse data, learning systems are given more combinations of tasks that improve the productivity of these learning models. Using crowdsourced data has proven to be a net positive and has the potential to see continued implementation for data sources. Despite this, there are many flaws with using crowdsourced data. Because data is created by an anonymous online community, there is a question on what is the quality of the data and how accurate is it really?
The academic paper this week concerns the growing trend of big data, learning models, and algorithms. The paper discusses how learning models need data that is labeled, but there are issues associated with gathering these large amounts of labeled data. The traditional route of labeling data is done by domain experts and is typically inefficient and costly. To combat this, researchers are turning to crowdsourcing the task of labeling data. Some potential problems that this approach currently holds includes the questionable quality of crowdsourced labeling and thus the questionable quality of the learning model developed from it. More more fine-grained inference models, more learning models, more deeply relationship between the label quality and the learning model quality, and theories of learning from crowdsourced labeled data are some future problems that should be studied in the future. My opinion on how to combat these problems involve maybe adding some type of quality control checking. If you're able to crowdsource all these data labels, then maybe you could also crowdsource the ability to check for the quality of these data labels. Another approach I thought of included adding some criteria for the labelers that are involved in the process to make sure they're adequately capable of handling the tasks that they're given.
Today, computer algorithms can predict things such as who is the best person for a job, who might end up in jail again, or how to solve a complex decision. Yet, nevertheless, many of these algorithms have biases that discriminate against race, gender, and economic backgrounds. Predictive algorithms are individually developed by private companies and are proprietary to them, which makes it hard for data scientists and researchers to analyze them. However, to avoid bias, whether it be racial or otherwise, one must train algorithms to avoid certain determinants or variables which can lead to biases. In terms of healthcare, it seems the best solution is to train an algorithm to determine patient risk factors by looking at variables like avoidable cost or the number of chronic conditions that needed treatment in a year in order to reduce biases.
Facial recognition or Facebook advertising algorithms are everywhere, and we use them on a daily basis. This week's article discusses how racial bias has been found in healthcare algorithms and how it affects millions of Americans from getting access to healthcare, specifically African Americans. According to the article, many of these algorithms are designed by private companies, and in my opinion, it may have something to do with these investors of these companies not wanting to adhere to other races. As you know, there's always been a long history of discrimination in the United States, and it's always been harder for African Americans to gain health care. Why? More specifically, because African Americans tend to be more involved in criminal activity and have a lower income, which results in a higher risk factor than when compared to other people when determining healthcare. As this racial issue has already been fixed, according to the article, and now that we're aware, another solution would have been to use healthcare software that is not from a private company and rather elsewhere.
Hi guys. In the second article, we learned that there are some computing algorithms in the healthcare industry that result in racial bias. We also learned that with this racial bias, the program does not admit as much access to blacks despite being of higher risk. There was a quote in the article that left a strong impression. Algorithms by themselves are neither good nor bad. It is merely a question of taking care in how they are built. In this case, the problem is eminently fixable. I think this quote is important because if we let bias into the system, then by default we will design around this bias. It is first crucial to understand our underlying beliefs before designing for something that can affect the users. It is easier said than done, but is something that could benefit the practice of healthcare. Everyone should be able to access and afford healthcare the same.